Today we'll talk about one-piece implants and we will compare one-piece implants with two-piece standard implants. Now, as the name suggests itself, why do we call it one-piece implants? Because the implant body, the transmucosal abutment, and the restorative abutment, all these three components are put together into one, that is, in one-piece implants. Whereas in two-piece implants, as we know, the implant fixture or the body and the prosthetic abutment or the transmucosal abutments all are supplied as three different components. Now, why one piece implants were introduced? They were introduced to overcome this three components to put together into one. Why? As we know, the more the component number increases in an implant system, there will be more attachment or the more junctions. So those junctions or those connections is a weakness to the component, the whole system. So why one piece implant? Why do we need one piece implants? Now, one piece implants have evidently few advantages over standard two-piece implants. Now, since all the three components are placed together, it can be placed in single stage. We don't have to go for a second stage uncovery. It can be placed with flap elevation, also without flap elevation. Immediate loading is possible with one-piece implants. Now, since there is a single component, there is no micro gap, so there is less of micro motion, which further reduces the marginal bone resorption and the inflammatory cells that are formed during this around this gap. Now, since there is no screw, so the chances of screw loosening or abutment screw fracture is very less. Also, the screw itself, in case of two-piece implants, the screw itself harbors bacteria, whereas since there is no screw present, there are less chances of bacteria accumulating inside or inside the internal surface of the implants. There is less marginal bone resorption. It is basically due to uh, since there is no micro gap, also less of micro motion. Secondly, since it can be placed at once go, so there is we don't have to go for the second stage surgical options, or we don't have to paste a cover screw and remove it and go for a healing abutment. So the less number of surgical stages that we follow, so the less mishandling or less handling of the tissues leads to better tissue, hard and soft tissue reactions. Now, since it can be placed in a single stage, it is we have a better patient comfort and fewer surgical steps. It is cost effective options. Now, as we know, the in case of two-piece implants, we have a abutment screw which is of around 2.5 mm in diameter. So the strength of that two-piece diameter implants, when you compare with a single piece, when since there is no screw, is much stronger because this is a unibody structure. The single piece component is a unibody structure. Whereas in case of two-piece implants, because of presence of the screw, the structure has got lesser strength when compared with the one-piece implant of same diameter. The marginal bone resorption around the one-piece implant has proven to be lesser than the two-piece standard implants. As mentioned in the study by Brokin et al., they have found that since there is an absence of implant abutment interface, so there is less amount of inflammatory cells that are accumulated near the connection between the implant abutment. There are less chances of there are less amount of bone resorption. Now the one piece implants are available in titanium by Nobel Direct, Zimmer one piece and Bi Horizon. All these are available in 3 mm of diameter. Usually, in the beginning, one piece implants were introduced as a straight head without any angulation, straight head one piece implants. But nowadays, different companies have also introduced 7-degree angled one piece implants. One piece implants also available in Zirconia by Z System Evo, Brilliant White Sky, Ural Iceberg, Cereroot, and it helps in placement of these one piece implants in the anterior region of maxilla or in the aesthetic region. Now, the most important question that comes in our mind when you think about one piece implant is where or which are the situations when can we place one piece implants. Now, the usually one piece implant or single piece implants are indicated in the maxillary and mandibular anterior region where a single central or lateral incisor is missing. Usually, the traditional implant diameter to be placed in the anterior region is of diameter of 3.5 to 4 mm. Now, many in many situations we find that the mesodistal space between the two tooth or the mesodistal space for the implant placement is very less, maybe less than around 6.5 mm. Also, the natural intra-root distance between the two central incisors in case of maxilla is around 2 mm, whereas in lateral incisor and canine it is of less than 1.5 mm. Now, in such situations, if we place the traditional two-piece diameter implant, we have chances of thread exposure, damage to the adjacent teeth root, and bone loss. Also, along with the bone loss, we have chances of losing the papilla. Now, in the anterior region, also we can place or the one piece implant is indicated where the mesodistal space is more. In such situation, instead of placing one one two piece implant with a larger diameter which causes a cantilever. Instead of that, we can place we can place two single implants of lesser diameter. So this can avoid the creation of a cantilever in such situations. In narrow ridge, usually in the anterior region, we find many times we can find knife edge ridges where we have to go for such process or such treatment procedure like GBR, ridge splitting, or bone spreading, or onlay graft. We can choose one piece implants or also the narrow diameter implant as an option to be used in such cases. Now, can we place one piece implant in posterior region? So far, we have seen that one piece implants are indicated in anterior region. So, in even in case of posterior region, where we have a missing molar or a premolar, many times we can see the adjacent teeth have moved or tilted, and the mesodistal space have been narrowed for a traditional diameter implant placement. So, can we place one piece implant in such region? Usually, one piece implants are not indicated, or two piece narrow diameter implants that are also available in 3 mm diameter are not indicated in posterior region. There are reasons for that, and they have mentioned in various studies that the since the if we consider a mandibular first molar, the mesodistal crown diameter is around 10 mm, whereas the mesodistal diameter at CEJ is 7 mm, and the recently or now available diameter of the one piece implant which is around 3 mm, or the two piece narrow diameter implant of 3 to 3.5 mm, they cannot fulfill the criteria of a proper emergence profile that can be fulfilled by the two piece implants. Also, since the occlusal load is much more in the posterior region, these one piece implants with a lesser surface area are amenable to generate more stress and go for fatigue fracture. Now, usually the abutment or the implant fractures or in case of if we place a two-piece narrow diameter implants, then we have a chances of screw loosening or fracture, or the fracture of the restoration. Now, we were talking about one piece implants. To overcome the problem with one piece implants, like that angulated abutments that cannot be placed with one piece implants, two piece narrow diameter implants are also introduced in implant dentistry. Now they are categorized basically into three categories: category 1, category 2, and category 3, depending on their diameter. Where in category 1, less than 3 mm of diameter implants are included. In category 2, 3.0 to 3.25 mm diameter implants are included, and in category 3 there are 3.30 and 3.5 mm of implants. Though it has been cautioned against using these narrow diameter implants in the posterior regions because of reduced surface area for osseointegration and more chances of probability of fracture. If we consider it in practical sense, if already the diameter is narrower of this two-piece narrow diameter implants, around 3 to 3.5 mm, and in a two-piece narrow diameter implants there is a abutment screw. So overall the structure of this two-piece narrow diameter is not so very strong to withhold the amount of force that is induced in the posterior area. So either the screw loosens or the screw fractures. Now, the ITI has given some guidelines for use narrow diameter implants. They have mentioned that it can be used in cases where there is reduced mesodistal space or reduced ridge width. Also, they have suggested that diameter should be the widest diameter that is uh, possible to use. The minimum length of the narrow diameter implant should be of 10 mm or more. A same guideline or the same kind of guideline also has been given by Saram et al. For the narrow diameter implants to be used in the molar area. Uh, they have suggested that when there is a bone quality type of 1, 2, or 3, or the minimum implant length can be chosen of 10 mm or more, implant protective occlusion can be given when there is no history of parafunction and the bone thickness is between 5 to 6 mm, or the implant with appropriate macro and micro geometry can be chosen. In such situations, we can choose a narrow diameter implants to be placed in the molar region. Now, the requirements uh, for the one piece or single implants to be placed in the anterior region, there should be minimum of 1 mm facial bone thickness, and the distance between the natural tooth and the implant should be maintained of 1.5 mm minimum or more than that. Now there are some limitations of one piece implants. Now as we already mentioned that usually the implants that are used as one piece they are straight headed. So if we have chosen to place a straight headed implants, we have to place the implants correctly because we don't have any angulated abutments separately to be placed to correct that angulation correction of that implant that is not placed properly. Now, it cannot be used in cases where the primary stability or the initial torque that is required cannot be achieved, because already we have a lesser surface area, lesser diameter with these implants, number one. Secondly, these implants are immediately loaded, so where we cannot have a primary stability, uh, we can decide that beforehand that we cannot achieve the primary stability. In such situations we should not use one piece implants. Abutment modification in case of one piece implants has to be done inside the mouth. When with two piece implants, we have an option to correct the abutment or modify the abutment inside the mouth, also in the laboratory on the cast. So in this particular, with this particular one piece implants, we don't have that options. Now, screw option is not available with one piece implants. Now, this is an advantage, also a disadvantage. Now, one piece implants are usually not recommended for posterior regions. Precise finish margin placement is difficult with one piece implants. Now, here this presentation ends, and we like to thank you for listening till now. If you have any doubt and queries, you can message me in box. And if you like this video, or if you like this presentation on this particular topic of one piece implants, please like and subscribe. And if you have in mind of any other topic that you like to be discussed upon, please message me in the inbox. Thank you.